moving on to the next question. This
Mhm.
question says, my father found some blood in his urine.
Mm.
His doctor did a few tests and said it was fine. Should we be worried?
Okay, and that's a very good question. A very common scenario that presents to our clinic because besides the GFR, we look at if we're having spilling protein in the urine or blood in the urine. Now, the again having a little bit of blood in the urine, again there are different ways to look at this. If we're actually seeing blood in the urine, which is what we call gross hematuria, where you actually can see it through the naked eye, that tells me this is probably something potentially from the lower urinary tract system. Could be coming from the ureters or the bladder. Could be a kidney stone. Could be a cyst. So, number of things. Now, so this is where we would take a step back and discuss with the doctor or see your doctor or your nephrologist, and they can make a decision. Okay, is this something that we need to look at further? Because there are certain disease processes, some certain collagen vascular diseases and stuff, where the first sign is blood in the urine, and then slowly what we can, and that can be associated with certain diseases like IgA nephropathy and things like that. So, have it's going to be very important that it is monitored. Of course, there are certain scenarios or processes where having a little bit of blood in the urine is a benign thing. You can have what's called a thin basement membrane syndrome, where the filter's thin and you're spilling a little bit of blood in the urine. It's a benign process, nothing to worry about, but definitely need to monitor here and there.
Okay,
I
so
hope that makes
you'd say that
sense.
we consult with a doctor, and
Yes,
just.
absolutely. Yeah, if you're having blood in the urine, so it's a wise thing to consult with the doctor to just to make sure, is this something that we need to follow? Now, your doctor will look at everything, and if he looks at your kidney count, and of course, if it's not gross hematuria, where if he's having a lot of bleeding or blood in the urine that he can see, he'll probably need a scope, where they'll go in with the scope and look at the bladder to make sure there's no masses and things like that or stones and stuff. That's going to be important. But if the blood is present and you can't see it, and it's only on the dipstick, that puts us in a different path of evaluations.
Hmm. Thank you for that advice. I think a lot of people here, we just chalk it off to, oh, it'll go away and take care of itself.
Hmm.
So I think we're gonna go start seeing our doctors now
Yeah.
when something
And,
like this happens.
no, you bring up a good point, because sometimes it could be just related to an infection, a bladder infection or something like that. So if it's in conjunction with an infection like that, just treating that alone will take care of it. But if it's persistent, that's when we'll say, okay, wait, let's just make sure like there's nothing going on. So definitely bring it up to a doctor to follow through.
Thank you so much.
You're
Uh,
welcome.